Earlier this afternoon, Ian Wright spoke with Alabama's health officer, Dr. Scott Harris, about the recent spike we've seen over the past few days. Here's more from that conversation.
I think it's important for everyone to remember that Alabama remains under a safer at home order. We have never ceased to have a safer at home order. We at some point were in a shelter in place, as you know, and then we returned to a safer at home order, which continues at this point through July the 3rd. We do believe people are safer at home. The numbers that we've seen over the past week or so are certainly worrisome. I think it's certainly possible that they could be attributed to Memorial Day gatherings, although it's always hard to kind of have a one-to-one correlation and prove that that's what it is. Certainly in some counties, we have an explanation for increases where we see, for example, an outbreak in a skilled nursing facility, or we may see an outbreak associated with a workplace. But there are definitely parts of the state where we have increased numbers just generally and don't really have an obvious explanation for it.
What do we need to do then to avoid a second wave statewide and avoid stricter measures that would keep more and more people at home and maybe close down some businesses?
Yeah, I think in a sense, you know, we're really still in the first wave. The first wave never subsided. And, you know, if you remember about 3 months ago when we first enacted health orders, we never saw the big hospital surges that we were anticipating. You know, we worried that we were going to have ventilator shortages and ICU bed shortages, and we were going to have all these hospitals go underwater kind of all at once. And that never happened. And I think there are a couple of reasons for that. You know, one is that the governor's shelter-in-place order really was effective. I think that significantly reduced disease transmission, that kept people from getting sick and kept people from dying. But also, I think we've learned some things about this disease that we didn't know at the time. You know, instead of hitting our entire state all at once, what we've seen is just kind of a sort of sustained transmission around the state at a certain level. But then for whatever reason, we see these hot spots that just pop up, you know, just almost overnight, like a fire that erupts. And so, you know, you can have a hospital that's doing perfectly fine, and then within a matter of a day or two, suddenly they find themselves underwater with large numbers of patients. And particularly that seems to happen when you have a vulnerable population, like a nursing home that gets infected. But we've also seen it, for example, here in the city of Montgomery, without an obvious locale or event to explain it. You know, we've just seen large numbers of disease transmission occurring all at once. So, you know, a few months ago when this started, we were talking about these hospital surges happening in Opelika and at UAB in Birmingham. And more recently, we were talking about issues in Mobile and some other places. Now we have, you know, pretty significant problems in Montgomery, and we've had them recently in Tuscaloosa as well. And so this disease appears to just pop up that way. And so it's just not all the same across all parts of the state.